with Dr. Jonathan Scholl, brought to you by Marcus and Mack, a law firm representing injured people. And he is a busy guy at Indiana Regional Medical Center. Dr. Scholl, good morning.
Good morning.
It's good to have you with us here today. My goodness gracious, you guys are under the gun up there at IRMC, and we appreciate your carving some time out for us this morning. This is a pretty important topic, though, isn't it?
It absolutely is. Yeah, thanks for having me on to talk to the community and get some knowledge out about what IRMC is doing is to prevent the spread and help keep the community safe.
Yeah, so let's begin with this word telemedicine and define it for people and talk about how it works in this day and age.
Absolutely. So telemedicine is a term that allows us to use technology to see patients. So this can be through the telephone or through a video conferencing apparatus. We've been able to successfully implement that at IRMC. And last week, we had over 300 visits occur via telemedicine.
That's amazing that people are glopping onto it pretty quickly, aren't they?
Absolutely, yeah. And also insurances have given a lot of support for it, where they can expand their coverage to cover these telemedicine interactions and allow people to stay at home, stay safe, and still see their physician and providers at their scheduled times.
Well, that is the key advantage of it, isn't it? You can stay in place and not have to go out and risk your health even further by visiting a doctor's office or just, a typical trip to a doctor's office is also going to involve, maybe we need to stop at the gas station, we need to do this, but it allows you to stay home.
Absolutely, and as the numbers continue to rise in Pennsylvania, I think the Pennsylvania Health Association said it was up past 4,000 confirmed cases in Pennsylvania as of this morning. It's best to stay at home, stay isolated, continue the social distancing, but we still want the patients to be able to interact with their physicians, and there's a lot of important things that have to occur, and allowing telemedicine to facilitate that is really a great thing, and using technology to care for our community.
All right, so you mentioned a couple of different delivery methods. One is by telephone, and one is a little bit more sophisticated. Let's talk about first telemedicine by telephone.
Sure. So telemedicine by telephone really it just allows us to call our patients, and we can register your appointment as a telephone interaction, and that can be a short discussion if there needs to be refills of medications or you have a concern over telephone and you don't have the capability or a computer or a smartphone with a camera to have that video interaction. This can be adjusted to using a telephone to interact with the patients, and we really want to make sure that everyone has the ability to stay at home, regardless of if they have a computer or a smartphone. Just using a normal telephone, we can also interact with our patients and help keep everyone safe.
And so that works over the telephone, but much more sophisticated, probably much more preferred, is the ability to actually have eye-to-eye, face-to-face contact, even if it is over a device. So discuss that for us a little bit, because the possibilities seem endless with that.
Absolutely. So using either your smartphone or your computer with a camera that is typically built into many computers and laptops. You can have a video interaction with your physician. And whenever this occurs, the physician is able to see mobility, functionality, if there's an issue with your shoulder or issue with any part of your body, a rash, things like that. There's a visual component to it that allows us to get a little bit more knowledge and information than you can get over the phone. So we definitely prefer using the video conferencing interaction. However, we want to, allow us to use multiple things to keep the options open for our patients in the community.
Yeah, you can think of where this will go down the road, the ability to take blood pressures and heart rates and things of that nature. And maybe that's occurring in some places, but just the idea that you can have that two-way conversation and the doctor can see you and you can see the doctor, it has to be pretty comforting for patients.
Absolutely, yeah. And in the future, it really can get expanded. There is a lack of access in the rural communities, and allowing people not have to travel so far to see their physicians and interacting through computers and phones is really the way things are, going to be going, as there's a, provider shortage in the United States. However, during this coronavirus, it is, just fits very nicely with allowing the patients to stay at home while still getting the care that they need on a daily basis.
Now, telemedicine has been around for how long at IRMC? How long have you been doing it?
It's been around, a couple of years. However, it really hasn't become very popular until this coronavirus. Last week we had 340 office visits occur via telemedicine with IRMC providers. And out of all the providers at IRMC, last week we had 35 providers participate in telemedicine. So this interaction via telemedicine has expanded exponentially during this coronavirus time, because I think everyone acknowledges the importance of keeping the community safe and having our patients stay at home in a safe environment while still receiving the care that they need from our providers here.
Now, that got a little fuzzy when you said that. Did you say 35 physicians?
Correct. Yeah, 35 IRMC physicians conducted telemedicine appointments last week.
Wow, that's a lot. And that, of course, would cover the whole range of types of physician.
Absolutely, yeah. This could be a PCP visit, as also a specialist. Pain medicine, we've converted all of our interactions to telemedicine. Orthopedics, can see patients as well. Sports medicine, all these things that they have routine visits. We're trying to, the hospital is really encouraging the providers to try to convert those to telemedicine interactions as best they can. Now, there were some things in medicine that, you have to be seen in person, whether that was a trauma or, a car accident, things like that, or if you had a major surgery and the physician, your surgeon needs to see you. There's clearly things that cannot be done over a computer or a telephone. However, we're trying to maximize what can be done during this critical time.
I would guess, and by the way, we're talking with Dr. Jonathan Scholl from the Indiana Regional Medical Center about telemedicine, which is a big thing and especially big now. I would guess, Dr. Scholl, that with nursing homes, personal care homes, especially since they're on lockdown now, and a lot of them have nursing staff on duty, that is just a tremendous way to treat a large number of patients and do so with really a minimum of contact with those patients. I'm assuming that is also the case, yes, that personal care homes and others can use this?
Absolutely, and the personal care homes really have the ability to have staff help them, set this up and interact with the computers and the cell phones in a way that, we can keep those patients isolated because they are at higher risk and allow us to, still establish the care that we need with them, that they need on a daily basis.
Yeah, and they've got that telemetry capability that we might not have in our homes, too.
Absolutely they do. And it's very simple to use the video conferencing. What happens is your staff or your office will provide the patient with a link to your virtual waiting room. Mm-hmm. You just type that link into your browser on your computer, and you type your name in, and then your name will appear in the provider's virtual waiting room. After you type your name in, you just wait for the provider to open up your interaction, and you'll soon see your provider's face on your screen. So it's very user-friendly. It can be done on an Android or an iPhone, as well as any desktop computer with a camera associated with it.
Wow! So there you are. You are actually in a virtual waiting room, and that's just an amazing thing. All right. So how do people take advantage of this?
So what you can do is give us a call. You can call your doctor's office, and they can switch your patient's office visit over to a telemedicine visit. There's also a number to call that I'm pulling up right now, but I'll be sure to get that number before we stop our conversation here over the radio.
Mm-hmm. Okay. So while you're doing that as a part of a secondary thing here, I want to talk to you about your personal experience with it. And obviously, we don't want to violate anybody's privacy as we continue this discussion. But you, Dr. Scholl, working with the telemedicine, tell me how that has enabled you as a physician to treat people and to do so quickly and much more quickly than if they had to drive in for a half an hour and drive home for a half an hour.
Absolutely. So what we have done is really incorporated the telemedicine into all of our patient visits, and it's really the provider, determining what can be seen over the video and during the telephone and telemedicine. However, it really gives the benefit where the patient does not have to come in. They can stay safe. They can not expose themselves, just like you said, to other things in the community, whether that's at a gas station, doors, handles, things like that. The virus can be live on surfaces for 3 days. So really, keeping the patients, especially the elderly patients, isolated in their homes at a stay-at-home order by the Governor Wolf in many of our counties is really the best way not to stop the spread of the virus. And telemedicine allows IRMC and the medical community here in Indiana to really do our due diligence on doing what's right and what's best for the community.
Yeah, it's a game changer. It really is. Okay, so you have that number now?
I'm still looking for it right now. So sorry.
That's okay. Andy probably has written that number for me 1,000 times, and I'm going through my book looking for it.
Okay, I got it right here.
You got it. Okay, good.
So in order for you to convert your normally scheduled office visit to a telemedicine appointment, or if you'd like to schedule a telemedicine appointment with your physician, you can call 888-452-IRMC. That's 888-452-IRMC.
That's beautiful.
When you call that number, you can modify your currently scheduled visit or schedule a new visit for a telemedicine interaction with your provider.
Yeah,
if you happen to have any symptoms, or you think you're having some of the symptoms of COVID-19, you should call your primary care doctor, and they can advise you on the next steps on what should be done if you are concerned about developing any of the symptoms that you hear on the news. Our IRMC physicians are always here to help you navigate that situation, which can be very stressful and uneasy for you as well.
Absolutely. Absolutely. Wonderful stuff. Dr. John Scholl, thanks so much for being with us this morning.
Absolutely. Thank you, Todd.
Have a great day.
Thanks. Bye.
There you go. The Indiana Regional Medical Center Telemedicine Center.